Bacterial meningitis में what do you have, doctor? PMN leukocytes more than 200. Then spontaneous pneumothorax में recurrent pneumothorax है तो you will do pleurodesis. Classically, which subset of people will have Marfan syndrome patients में recurrent spontaneous pneumothorax होता. क्यों होता? If your thorax height is longer, higher, then the amount of pressure created at the apices of the lung will be higher in a tall lungs, and that will blow the bullae, leading to development of pneumothorax is what need to be basically remembered. Now doctor, what is recognized non-metastatic feature of the carcinoma of the lung? These are all paraneoplastic syndromes, but not polyuria. Syndrome of inappropriate ADH secretion will lead to development of not polyuria. Excess ADH will lead to retention, no? Antidiuresis. That's a point. Okay. Now doctor, renal disease which you see in case of Hodgkin's क्या होता है? Actually membranous nephropathy more likely to be even minimal change disease. That's a point. Huh? What was your answer? You only know, huh? Not my MPGN. Membranous or minimal change disease, either of the two. Huh? That's the point. Overflow proteinuria. Typically, where will you see in the urine? In case of multiple myeloma, overflow proteinuria can occur, is what need to be remembered. Then, renal involvement in rheumatoid arthritis is due to what? It is due to amyloidosis, gold and penicillamine therapy, NSAIDs, anything of them are basically responsible. Right. Still it is freezing. Why? Still, even here also it is freezing. Huh? This sharing system, but outside please do check. Now doctor, in Fanconi's, where is the defect? Proximal tubular, glycosuria, aminoaciduria, etc., they are all basically found. Now, patient has asymmetric kidney along with hypertension. What is the possibility? You will think of renal artery stenosis. Then tubular dysfunction के वजह से होने वाला problems क्या होता? Gitelman, Bartter, Fanconi, any of them. Cystine stones में, what do you want to do with urine? Urine pH should exceed 7.5. Hence alkali is basically required. Myopathy or myalgia is not a feature of doxy, but penicillin, glucocorticoids, etc. is what need to be remembered. Earliest sensory loss in case of diabetic nephropathy is vibration, is what you need to fundamentally remember. Bilateral loss of ankle joint with extensor. Why it is so important? Areflexia is a feature of LMN or UMN? LMN. But extensor response means Babinski. Babinski is a feature of UMN. So where do you find combination of LMN and UMN? Only in 3 scenarios you find the combination. One is Friedreich's ataxia. Second is vitamin B12 deficiency. Why? Vitamin B12 deficiency में myelin formation में problem होता. Peripheral nerves are involved. Because of the neuropathy, which is an LMN, you get areflexia. It will also lead to demyelination of pyramidal tract in the spinal cord. And because the pyramidal tract, corticospinal tract is involved, you get UMN. Similarly, another situation, motor neuron disease also, you find combination. Motor neuron disease mein Andrehorn cells are destroyed. That is the reason LMN, areflexia, LMN features in upper limbs. And pyramidal tract also will suffer sclerosis, corticospinal, corticobulbar, everything. Hence you will get UMN in the lower limbs typically. UMN features in lower limb, LMN features in upper limb. So where do you find combination? Batao jaldi fatafat. Friedreich's ataxia, subacute combined degeneration of spinal cord, tabes dorsalis, Abhiram is adding an excellent point. Tabes dorsalis also similar situation. Both pyramidal tract and Andrehorn cells, both of them are involved. LMN, UMN combination is what you typically come across. Huh? Here tabes is also given. Huh? Okay. Amyotrophic lateral sclerosis is also there. No? Oh, I see. I think they should give except. Sorry for that. Then what will be the answer? Syringomyelia become answer. Okay. Then each lobe functions is a very important question. So sensory extinction, hemi-neglect, idiomotor apraxia. What is the meaning of apraxia? Apraxia is not recognizing. In spite of a normal power, normal deep tendon reflexes, normal sensory system, inability to execute a motor activity is called apraxia. Power normal होना, tendon reflexes normal होना, ये सब होने के बाद भी idea नहीं मिल रहे. What is the answer? So what is that? That is called MCQ apraxia. पूरा हैरिजन पढ़ा, पूरा अंडरलाइन किया, सब कुछ नॉर्मल है, फिर भी रैंक नहीं मिल रहे, इसको बोलते हैं एंट्रेंस एप्रैक्सिया. कम आउट ऑफ दैट. देन central nystagmus, what is except? Typically Meniere's lead to development of peripheral nystagmus due to hydrops. Then large vessel vasculitis, which one? Takayasu. So you must know middle, small, large. One vasculitis जरूर entrance में आएगा. Digoxin, where is it indicated? In all this but not in high output failure. High output failure means already दिल को भगा रहे आप, anemia, pregnancy, beriberi में, heart is racing, heart is pounding, pulse is beating. In that situation और काम करो बोल के सास जी के जैसे बैठ के आप दिल को बोले तो वो फेल हो जाएगा. अगर वो लो आउटपुट फेल्यूर है, कार्डियोजेनिक शॉक है, वैसे सिचुएशन में आप डिगॉक्सिन दिए तो कुछ मतलब है. दैट्स द पॉइंट. क्या डी? या पीएसवीटी में व्हाई विल यू गिव डिगॉक्सिन? कम ऑन डॉक्टर. पीएसवीटी इज अबव AV node. Digoxin has parasympathomimetic activity. It will make AV node refractory and prevent the atrial fibrillation from passing into ventricle like a gatekeeper. That is the role of digoxin. For controlling the ventricular rate is what need to be remembered. Right. Arsenic किसके लिए इस्तेमाल करते? Not to kill the spouse. Polonium poisoning, of late the new poison. Forensic में already आप arsenic के लिए prepare है. Polonium is not there. So this time entrance में आ सकता. Polonium poisoning में क्या क्या symptoms रहता है? एक vomiting and then death after coming from a second show movie. So that's acute promyelocytic leukemia में arsenic trioxide is what you need to basically remember. Suresh, please check how bad is the freezing part. Yeah. Digital clubbing is not a feature of aortic dissection. You will die before clubbing develops in aortic dissection. Clubbing के लिए थोड़ा time मिलना चाहिए ना. Acute aortic dissection. Have you seen one aortic dissection patient dying? No? Array doctor. Patient will be talking to you. My second daughter, nice son-in-law only, doctor. Third daughter, still not yet married, doctor. That 4 acres has to be, I have to quickly mortgage it. So many things patient will be talking while slowly he is sinking into coma. I can never forget, Krishnaya was my patient of aortic dissection who died, talking all about what are his plans of life. So that is the reason, doctor, when you are preparing for entrance, why do we need MD? MD is not just for earning money or becoming famous. You can become famous many ways. You can earn money thousands of ways. It is at least we should feel that it's an opportunity to learn the skills to treat somebody else in pain. At least anyway, after doing MD you will become insensitive and start running behind ATM. But during preparation, at least the prayer to God is, make me that one selected out of thousands to get a good seat, to learn some good skills, to be of a good instrument to work. Then you will not have anxious mind waiting for result, anxious mind waiting for popularity, or anxious mind waiting for settlement. No settlement, doctor. Where is settlement? All unsettlement begins with MD. Be very sure. Settle hona bole to go to the top of a hill and jump. All settled. So, increased anion gap with metabolic acidosis. Still freezing. Okay.